Let's bring in Dr. Tom Frieden. He is an epidemiologist and the president and CEO of the Global Health Organization Resolve to Save Lives. Doctor, thanks for being with us. The efficacy of Moderna's 2-dose vaccine regimen for children under 6, it seems fairly low. Why is that?
Well, there's a lot that we don't fully understand about kids' immune systems, and also the dosage needs to be optimized. But the big picture here is that between vaccines and great treatments like Paxlovid, there's no reason that we should have the kind of death rate that we've had in the past in the future if we continue to vaccinate and treat.
Doctor, why, though, has getting vaccines for that under 6 age group taken so long? Who else is working on vaccines at the moment?
It's interesting. We've come to have much higher expectations. The speed with which safely and effectively we have vaccines is really unmatched. Because the severity of COVID is so much less in kids, the bar has to be higher for a safe and effective vaccine, and we always want to make sure that safety comes first.
Do you believe it's been too slow of a process?
I think we need to make sure that we're not cutting any corners on safety. I know there are lots of parents out there who are eager to get their kids vaccinated. There are other parents who are not interested. But bottom line is we need to look at all the data, have that data available publicly so that not just the FDA, but doctors, nurses, pharmacists, and parents can make an informed decision to protect their kids with vaccination.
Doctor, as parents try to make an informed decision, they look at data, and CDC data shows that less than 30% of children ages 5 to 11 have received 2 doses of the COVID vaccine. So what does that suggest to you about vaccination rates for children in that age range and those even younger?
It's not just kids, Bob. It's across the age range. There are too many seniors who haven't gotten a second dose or boosted. We have lost steam on vaccinations as people have just gotten tired of the pandemic. But the fact is, the pandemic, the virus is continuing to spread throughout the U.S., and vaccination is the best way to get that protected so that you won't get COVID and you'll be much less likely to get long COVID. Vaccinating kids is an important step, but we want to take that step carefully.
Dr. Frieden, I was on a plane last night coming back to Washington, D.C. Some people were wearing masks, some weren't. What would you do if you were on a plane today?
It really matters who you are and who you live with and what you're concerned about. If you're worried, mask up. If you've got an immune system weakness because of medication you're on or something else, mask up. If you're older and frail or live with someone who is, mask up. And you may even want to up your mask game to an N95 mask. If you're young and healthy and people around you are young and healthy and you don't want to wear a mask, don't wear a mask. But keep track of what's happening, because cases are likely to increase again and we may get another variant. Maybe it'll be less severe, maybe it'll be more severe. The virus adapts and we need to adapt also.
Where do you see the virus going in the spring, in summer in the United States? You said you expect another variant potentially, but where does this go in terms of the big picture scope of the pandemic? Over or not?
Well, it's really too soon to say what's going to happen in the future. What has changed is that we have great vaccines and great treatment. And that means that we can tame this virus so that it isn't nearly as deadly as it was 2 years ago or even 1 year ago. And that's a game changer. I do think we're going to see cases and hospitalizations increase in the coming weeks. That's likely. Beyond that, only time will tell. Only time will tell if we get worse variants or even variants that can get around some of our vaccine-induced immunity. That's why we need to continue to track and adjust our behavior as the virus adapts to us.
There's no word that seems to give me a shudder these days like variant. Dr. Frieden, we appreciate your time and your insights. Thank you.
Thank you.